Dermal fillers are substances that are placed underneath the skin to augment volume. So as we age, sometimes we lose volume in certain areas of the face that, give away our age. Volume can also be used in areas that are thought to be deficient. So, for example, someone whose chin is a little on the small side, you can augment the chin, or you can augment the lips if you need to, with these substances that are safe to place underneath the skin. Now, there's various types of substances, and probably the original one was collagen. And collagen is something that we all have in our skin. The problem with collagen back in the day is just that some people were allergic to the preparation, so you had to have a test to see if you were allergic to collagen prior to having it injected under the skin. Nowadays, we typically use hyaluronic acid, and hyaluronic acid is a substance that you have in your skin as well, but there's no potential for allergy to it, so we can go ahead and use it in patients without doing allergy testing. These are substances that are dissolvable or temporary. And in my mind, I think the temporary fillers are the ones that are the safest. So in our clinic, we tend to stay away from things like silicone or any of the materials that are thought to be permanent. I'm always concerned as a surgeon that 5 years, 10 years down the road, I'm going to be doing surgery on someone and find this material that was implanted in there that might have autoimmune reaction against it, or may form granulomas and things like that. So I think long-term fillers are out there. Certainly silicone has been around for a long time, and it sort of comes and goes in and out of favor. Personally, I think it's much safer not to use permanent fillers. So in our practice, that's sort of the standard. Although I do see patients who've had permanent fillers performed for them overseas, that sometimes come to see me with regard to that. So it's something that we do see, but we don't generally offer our patients. So the philosophy around injectable fillers in our practice encompasses a fairly conservative strategy that I have as a surgeon as well. And so all of my staff, we have registered nurses who have years and years of experience. These are the best of the best. They do all of the injections here in the clinic. And this is a real specialized part of medicine, and particularly of aesthetic medicine. And I think that those injectors are doing this all day, every day, and they're very good at it. And not only do they have great technical skills, but they have a sense for what looks good. Now, it's different than what things were what people wanted 10 years ago. I think what people are looking for now is slightly different, and I think my nursing staff has a real finger on the pulse in terms of what looks good and what people really want. And I think that's very important in addition to having great technical skills. In our practice, we tend to be quite conservative. I really don't want to see people walking down the street that clearly came out of our office having just had fillers. I want people to look natural. I want them to look good and be happy, but I want the results to be, in a lot of ways, undetectable. If someone comes out of here looking good or looking better, it's really what we want. We don't necessarily want to see people with extreme volume changes or extreme shape changes that you probably see on the internet. So the keys to success in a dermal filler practice like ours is, first of all, to get to know patients, making sure that we are solving the problems that they're coming in for, starting slow, not going crazy initially with large volumes that make people uncomfortable, but just trying to sort out the problems people have. If it's just a small lip augmentation that they might need, or just a bit of volume in their cheeks, I think we like to start slow and work our way up from there. I think it's very important as well to establish a good relationship with your injector. They often have great suggestions for little things that might make a person's result just that little bit better. And I think they also get to know our patients well, and they get a sense for whether some people want to be maybe a little bit more conservative and other people want to be a little bit more out there with their look. I think there's a range that people seem to like, and it's very important, I think, for our nurse injectors to have a relationship with those people that's long-term, so that those patients trust our nurses and they know that they're going to get a good result when they come to see us.